When it comes to health concerns, we know that anything dealing with your heart should be taken seriously and it should be addressed immediately. But what if the symptoms are maybe less obvious? What do you do in that case? Well, today we have Dr. Michael Buschur, a cardiologist with Mount Carmel Health Systems, helping breaking down this complex medical condition. Doctor, this is called aortic stenosis. Maybe people have heard the term, but they don't exactly understand what it is. So let's kind of break it down anatomy lesson-wise, right? First of all, what is your aorta? What's the function of that? What does it do for your body?
Right. So the aortic valve is one of 4 valves inside the heart. The aortic valve actually connects the heart to the aorta. So every time the heart beats or contracts, this valve opens up, allowing blood to pass from the heart through the aorta. And the aorta is a major blood vessel that carries blood throughout the rest of the body. Okay. In aortic valve stenosis, the valve itself is not opening for a variety of reasons. And over time, calcium builds up on the valve, making it thickened, and it starts to not open more and more gradually over time. When that happens, it can lead to a variety of symptoms. And when that starts to happen, we talk about different ways to get the valve replaced or get the valve treated.
Yeah.
Now, when this valve starts to thicken, it's not from anything patients do or don't do. It just happens to some people as they get older. Worldwide, the most common reason for it is rheumatic fever. Now, we don't see as much of that in America. What we see is that typically in elderly patients, the valve starts to thicken, and that leads to symptoms. And that is kind of one of the major reasons that is why we want to go and replace the valve.
Okay.
Very rarely, there can be a congenital issue with the heart where the aortic valve doesn't form the correct way. And that's something that can lead to aortic valve stenosis at earlier ages.
At earlier ages. And so essentially what you're saying, just to understand kind of how this works, so blood flow is limited. So the heart is then working overtime to do its job.
Correct. So the aortic valve typically is about the diameter of a garden hose. And when aortic stenosis progresses, that diameter narrows down to about the size of a straw. So the heart is working harder and harder to try to force blood through an opening that's getting smaller and smaller. And over time, that extra stress on the heart can actually lead to heart failure, which can lead to a lot of symptoms. And if the valve is not replaced in time, sometimes that heart failure can be irreversible, even with a new heart valve.
And when you talk about the fact that it does get worse over time, it gradually can change, do you see a lot of folks then maybe ignore some of the symptoms early on, maybe not realize that a symptom is even a symptom of what is happening?
Yes, exactly. Yeah. Because it's such a slow progression, people may think that they're deconditioned or they're just not as active as they were because they may be noticing shortness of breath or chest heaviness, especially with exertion. It's not like a heart attack where there's an acute onset event. This is a very, very slow progression, but over time, the heart can't keep up with the worsening of the valve. And the symptoms can get to the point where people are profoundly limited and can't even do their normal activities. So it's really important to not only have regular follow-up with a primary care physician to have this screened for, but if symptoms develop, then to get in to see a cardiologist before it's too late.
And talk about that screening, that diagnosis process, because should somebody be nervous about it? I feel like a lot of times that's why they hesitate, right? I don't want to go through something severe, but I think it's a pretty simple.
It is. So, one of the most common things is just by listening to the heart, we can hear a heart murmur. And a lot of patients have been told at some point in their life they have a heart murmur, and aortic stenosis is one reason for that. When we want to look a little closer at the heart, we do a procedure called an echocardiogram. It's a very easy, non-invasive procedure, which is essentially an ultrasound of the heart. Same idea as when a woman's pregnant, but we're looking at the heart muscle instead.
Okay.
So we put the cold gel on, we can take the measurements we need of the valve, as well as taking pictures to assess the severity of the valve, and that way we can follow it and see when we do need to look at treatment options.
And if you do not treat this, if you do not address it, you're saying that can lead to heart failure, right?
Correct.
So it is severe and you need to get it taken care of.
Correct. And because in most patients, it's not from anything they're doing or not doing, there's not medications that we can use to treat it. And so when it gets severe, when it gets to the point where it's causing symptoms, then we have discussions about ways to replace the valve. Now, historically, it used to be the only way to do that was with open heart surgery, which works very well, but it's a big surgery and can have a long recovery time. And some of our patients have too many comorbidities or they're not healthy enough to undergo a big surgery like that. In the last 20 years, we actually have a minimally invasive way called TAVR, which stands for transcutaneous aortic valve replacement. And physicians can go in through the artery in the leg or sometimes the artery in the arm and put a new valve in that way. Now, being minimally invasive, we actually have patients up walking the same day.
Wow.
And the majority of patients who have the procedure spend just one night in the hospital and they go home the next day. So the recovery time is markedly less than having to do open heart surgery.
And that's certainly something I think in the medical industry, there is innovation happening every day.
Right.
And so if somebody has had this or maybe been fearful of it, to know that they are making moves towards making this something that people can go through with an easier recovery is great.
Correct.
Yeah.
And at Mount Carmel, we're doing a lot of ongoing research, not only with advancing TAVR technology, but really throughout the whole department of cardiovascular medicine.
That's incredible. Okay, so a takeaway for viewers today, Doctor, you have any advice, last minute words?
So the biggest takeaway is make sure you have a primary care physician, go for routine exams. They'll be able to listen to the heart, screen for this type of condition. And anybody who's developing symptoms, whether they're limited by shortness of breath, chest pain, something doesn't feel right, don't try to just stifle those symptoms, but make sure you bring it up with your primary care doctor so you can be evaluated.
Yeah, just know if something doesn't feel right, you can ask somebody to check it out. All right, Doctor, appreciate you. Thank you for being here.
Thank you very much.